Hi, this is Lindsay Sullivan back at Bone and Joint Institute, continuing our monthly Facebook Live series. So today I have Dr. John Klekamp, one of our spine specialists today. So Dr. Klekamp, thank you for your time today. Today we're going to be talking about neck and shoulder pain. Everything's kind of right up here and they can kind of have a little bit of overlap, but there's ways that we can tell which is which. But before we start with that, Dr. Klekamp, tell me a little bit about yourself.
Thanks, Lindsay. Glad to be here. My name is John Klekamp. I've been practicing in Nashville for professionally 20 years, but I actually did my residency here starting in 1990 and went through Vanderbilt Orthopaedic residency program, so essentially been here almost 30 years. I see all sorts of things spine, from the base of the neck all the way to the tip of the tailbone, and enjoying seeing patients hopefully get by through treatment with non-operative treatment, but if surgery is required, we can do that as well.
Awesome. And speaking of the spine program, tell me a little bit about the spine program here at Bone and Joint Institute.
We have a comprehensive spine program at Bone and Joint. We have 3 spine surgeons, myself, Dr. Michael McNamara, Dr. Casey Davidson, and then we also have a physiatrist, Dr. Zach Kalb, who's one of our non-operative spine practitioners. He performs our injection therapies such as epidural shots, facet injections. We have physical therapy, all spine specifically trained physical therapists. We have physicians extenders who all rotate through our spine program, are all well versed in spine treatment and evaluation, diagnosis, and treatment. We have diagnostic imaging. We have MRI, which was just now being installed, which probably won't be active for another month or so. Currently, we have a CT scan, and of course, we're very close to Williamson Medical Center, right across the parking lot, which has all sorts of diagnostic studies for all our inpatient needs. And then we have a surgery center for all our outpatient surgical treatment options.
Awesome. Well, today, like I said, we're going to talk about neck versus shoulder pain. So, because many people experience pain up here, whether it's related to headaches or anything like that. So when you see a patient, how are you able to differentiate between the two?
That's a great question, Lindsay. So there's a lot of overlap. You would think that it would be very easy to distinguish between neck and shoulder pain. And that's not to say that some people can have both. So you can have problems with both your neck and shoulder. But ideally, I get an idea from the history, from interviewing the patient. If they tell me that their neck started in their neck and then radiates over their shoulder, and there's numbness and tingling and burning involving their muscles and arms all the way down to their fingertips, that sort of tips me to believe that it's more nerve related. If they're telling me that their shoulder started hurting initially and then maybe started radiating up to their neck, it hurts to reach into the back seat of their car, it hurts to reach above their head, and they feel a clunking in their shoulder or mechanical symptoms with their shoulder, kind of leads me to believe that it's more of a shoulder issue. But it can be very hard to distinguish.
So as far as imaging, do you do any types of imaging when a patient comes in and then after you've seen the patient to help determine that as well?
Yes, so after interviewing and then a physical exam, and the physical exam in and of itself can really help with distinguishing between the neck and the shoulder. Afterwards, if I'm very believing that it's more of a neck issue, we'll get cervical x-rays. If I think that it's more shoulder related, we'll just get shoulder x-rays. If I'm not sure yet, then I'll get both.
Okay, and then is there anything such as, would an MRI show anything after they've seen you?
Yes, so after initial treatment, there are other treatment options that really help with, for me to distinguish between neck and shoulder pain. If I'm suspicious that it's a shoulder issue, but I'm not absolutely sure, oftentimes I'll offer or suggest to the patient that we try a shoulder injection, and we can do that during their visit in the office. I'll just numb the shoulder up and then inject a cortisone injection. We'll wait 10 to 15 minutes, and if their shoulder gets better, then I'm pretty sure it's a shoulder issue. If, however, it doesn't get better, oftentimes we'll try some anti-inflammatories, some physical therapy on the neck and shoulder, and then have you return to see me in a couple of weeks. And if we're not getting better, then we'll end up probably getting an MRI of something, either the neck or the shoulder. X-rays are good at looking at bony alignment, but MRIs will show soft tissue abnormalities such as disc herniations, bone spurs, pinched nerves, or a rotator cuff tear.
So you talked about if kind of what the track would be, kind of distinguishing between the two, but once you know that it's shoulder pain, what do you do with a patient if you are for sure that it is shoulder pain?
If I'm fairly certain it's shoulder pain, I will, I mentioned doing the shoulder injection. And part of that treatment option, I will also do non-steroidal anti-inflammatories and physical therapy.
Okay, and then the same for similar, only treating a different part for the neck. So treatment options as far as physical therapy and anything else for neck, if you think it's neck pain?
Yeah, so there are a multitude of different medicines, anti-inflammatories, muscle relaxants. There are nerve calming medicines that I use, gabapentin or Lyrica, if some of you are familiar with those. That can help with some of the burning, pain down the arm. And then sometimes even oral steroids are helpful.
Okay. And so once you've done kind of those initial treatments, if it's still not helping, we'll say the neck pain, what are some other options that somebody has kind of down the road? Once
we establish where we suspect the pain is coming from through an MRI, then oftentimes we can do an injection. And that's where I get Dr. Zach Kalb involved. He's our injection specialist. We have a fluoroscopy suite here at the Bone and Joint Institute. And if I can see an area where I suspect a nerve is being pinched, I can have Dr. Kalb underneath a fluoroscopic imaging machine guide a needle to that area and inject a long-acting cortisone, combination cortisone and numbing medicine. 75 to 80% of the time it'll really help with the pain.
Awesome, awesome. And again, that's all things that we can do here at the office, just adding to the comprehensiveness that we can offer. I know you talked about it a little bit at the beginning with comprehensive care, but do you want to comment any more on comprehensive care that we offer here as a Bone and Joint Institute?
Yes, so mentioned having you see Dr. Zach Kalb, my physiatry injection specialist. If there is a shoulder issue, I suspect, I have 6 or so, or maybe even 8 partners that all do shoulder evaluation, treatment, and surgery if we need to go that route.
Okay.
So, yeah, we have all bases covered here at Bone and Joint.
Awesome. Well, Dr. Klekamp, thank you again for your time today, and we appreciate you tuning in to help us figure out differentiating between neck and shoulder pain. But if you have any questions or need to schedule an appointment with Dr. Klekamp, you can visit our website at www.boneandjointtn.org or give us a call at 615-791-2630. Dr. Klekamp, again, thank you for your time today. We appreciate it.
Thanks, Lindsay.